Kia ora, Marilyn Hedden, Senior Policy Analyst at the New Zealand Nurses Organisation. I just a little bit really interested in how nurses are going to be in this model, because it's really great to see equity, which doesn't appear and certainly didn't appear in the original plan. And we made quite a comprehensive submission on that. And I am just a little bit concerned about, I think we totally welcome the better use of pharmacist skills and working with them, and we've got very many models, the nurses, GPs, pharmacists working very closely together, particularly in rural areas that are totally dependent on each other.
Yes,
absolutely fantastic. But what we are concerned about is the primary healthcare focus, and in a way that this is another commercial model of access to primary health care, because it's a service there, and what consideration has been given to utilising the nursing workforce, which that model of assessment, referral, etc., is very much part of their scope of practice. That's basically it. We're concerned about the costs involved, basically, to the consumer.
Oh, you mean the consumer cost of access? Yeah, so that's one of the things, that the opportunities that we have by engaging with the pharmacist workforce is, again, we can really reduce the barriers to access. So one of the things we see with vulnerable populations is they actually quite often use their pharmacy as their first point of access, because they get quite a lot of advice from their pharmacist without having to pay for it, which is one of the reasons why we're keen to support pharmacists to be those professional advisors. In terms of the interaction, though, with nursing, I really like what you're talking about. So what we need to do is, as part of those local service designs, is to come up with, I can, straight off the top of my head with your conversation, I can see a multiple range of models that we could do. And this is the opportunity. The contractual arrangements and the commercial arrangements that you referred to have been getting in our way. So this is one of the reasons why we want to change this, because it gives us opportunities to create entirely different models, particularly for the vulnerable populations. And I can certainly see nurses and pharmacists working alongside each other on maraes and in different locations to create that level of access.